Hello and welcome to this week's edition of Health Talk. I'm Peter Ndor, and today we'll be focusing on substance abuse. Now, the South African National Council on Alcohol and Drug Dependence, SANCA, Drug Awareness Week takes place from the 21st to the 27th of June. And International Day Against Drug Abuse and Illicit Trafficking, or World Drug Day, is marked on the 26th of June to strengthen action and cooperation on achieving the goal of a world free of drug abuse. The theme for World Drug Day is Share Facts on Drugs Save Lives. Now, coming up on the program with this in mind, we listen in on an insert produced by one of our Northern Cape reporters, and he speaks about to a recovering addict, and we also speak to a young woman and a young man who are currently receiving treatment at a clinic for their addiction. We also listen in on another insert produced by Health E News about a young man's addiction and road to recovery. We then speak to the Chief Director for Families and Social Crime Prevention from the Department of Social Development, all about drug abuse and how to access these rehabilitation facilities. And we'll also be speaking to the Chairperson of the Central Drug Authority Board at the Central Drug Authority of National Social Development about the progress of the National Drug Master Plan that was launched in 2020. But first, let's take a look at the latest South African COVID-19 numbers, and this is the picture. There's the story there. A total tests, 12,633,235 is the number there, and the COVID-19 levels of the new infections in most provinces of the country continue to increase. All right. Okay, so the national statistics are, as of the 22nd of June. All right, so total tests, 12,633,235. Positive cases, 1.8 million. Total recoveries, 1.6 million. Active cases, 119,030. And the total deaths, sadly, 59,092. And you've got new cases coming through, 11,093. All right, let's now take a look at the infection numbers recorded in the provinces. And Gauteng still way out in front, and this seems to be the center of the third wave at the minute, to 567,681. KwaZulu-Natal behind with 347,600. The Western Cape just under 310,000 there, and the Eastern Cape just over 203,000 people. Those are the positive cases as of the 22nd of June. All right, let's take a look at the provincial statistics. Free State, 110,910. Mpumalanga, 89,268. The Northwest Province, just under 88,000, as you can see there. Limpopo, around 70,000. And the Northern Cape, just over 57,000. All right. Okay. Now, to prevent the spread of the virus and the third wave across the country, we're all still urged not to become complacent as the virus is still around. So let's continue to take precautionary measures, and these include regular hand washing with soap and water, as well as the virus that stays active on surfaces. So we need to kind of sanitize those as well, using sanitizers containing at least 70% alcohol content. That's really, really important. And we also must continue to wear cloth masks that covers both the nose and the mouth in public. Please cover your nose. We must also continue to practice social distancing and ensure proper ventilation indoors. If you believe there's a change, you may be infected with the virus, well, call ahead to seek medical help from your healthcare provider, or use the public hotline at 0800 02 9999. That's 0800 02 9999, and alert them to your symptoms to protect yourself and protect others. All right, okay, I think I might have understated a little bit the total number of tests, and I think I might have said another number, but that I think I said 12,000, but as you can see clearly, the total number of tests there is 12,633,235. So that's the total number of tests that we've done in the country, in a country, of course, with 58 million people. So it may be that there are people who are positive, who are not symptomatic, have been positive, not symptomatic, that are spreading the virus. So it's important that you don't just focus on these statistics, but just assume that everybody around you potentially is positive and could be passing on the virus. That's why you really need to be careful. Okay, so those are the statistics, but don't forget, we've got so much more to unpack, and today we're focusing on substance abuse, so stay with us for that. All of that's still to come. Welcome back. You're still watching Health Talk, and just before the break we were looking at those statistics, and don't forget that those statistics are only at a moment in time, and they often can change, and significantly at times, so that's something to bear in mind. Also something to remember, you can also be part of the show by asking our guests some questions that you have on your mind, or you could simply share some of the views on the issue that we're discussing, and today of course that's substance abuse. And the number to use is Johannesburg 011 714 5861 or 5877. That's Johannesburg 011 714 5861 or 5877. And you can also catch us on social media, and our Twitter handle is at SABC Health Talk, or you can find us on Facebook, and our page is SABC Health Talk. We'd love to hear from you. And don't forget, you must call if you've got a question you'd like one of our professionals to answer. Okay, let's now start looking at that big story, substance abuse. More than 35 million people around the world are addicted to drugs, and that's according to the latest report from the United Nations Office on Drugs and Crime. The 26th of June has been set aside as International Day Against Drug Abuse and Illicit Trafficking. Marking the day, reporter Reginald Witboy spoke to a recovering addict.
These are but many objects drug addicts use to satisfy their addiction. And being on a high doesn't last them too long before the craving starts again. A scourge destroying families and communities. Substances are easily available. 35-year-old Elmondro Kalis, a father of two, started dabbling in drugs at the age of 12. His addiction went on for 28 years. He even suffered third-degree burn wounds.
I wasn't forced to smoke, or I can't say I come out of a underprivileged family, because my mother and father gave me everything I needed in life. Just a choice I made to smoke. I would say I was like, I wanted to fit in with my peers. And that resulted in me ending up being addicted to mandrake, stick, alcohol, dacha, cat.
Family members bore the brunt of his addiction.
We went through a very difficult time because Elmondro was using drugs like constantly. For one day he will smoke like 6 times a day. At one time, we found him here on the cross. He almost drowned. He was stealing from the family. They had to hide everything in the house, away from him, like food, everything. He will steal anything just to get his necks fixed.
Kalis lost his job, family and children, but he's turned the corner.
To be honest with you, I didn't want to go to a rehabilitation center. And my mother had to take out a restraining order for me to go. And I went like as an involuntary service user. And when I came there, I realized that they gave me tools to recognize who I really am.
The Northern Cape Social Development Department has limited resources to fight drug abuse.
No, they are not. In fact, we are lamenting lack of support on the part of the NGO, because there are towns and villages, including municipalities across the province, where there are no facilities where this service is rendered.
While community members report drug lords, they say some police officers are in cahoots with the dealers.
I can't deny that. It might be possible. That's why, if really they have information about police officials who are involved in criminal activities, especially dealing with drugs, they are free to approach us so that those members can be dealt with.
Police can clamp down on dealers, families can beg and threaten, but as Kayla says, the first step must come from the addict.
My advice for other addicts out there, I know it's not easy and you wouldn't like to admit that there's a problem, but I assure you there is a problem. And without you acknowledging it, you'll never come out of the hole that the addiction has on you.
As a brighter future beckons for Kayla, he hopes sharing his story will help others. For now, his focus is on restoring his dignity and regaining his family's trust. Reginald Witbooi, SABC News, Kimberley.
Yeah, powerful story there, and it is always valuable to hear from people who've gone through this journey and perhaps are still on it, just how difficult it is and how easy it is actually to fall into these habits. And just after the break, we'll be speaking to a young man and a young woman who are both recovering from addiction. We're going to call them Stephen and Mary. They're not their real names, but they've got a powerful story to tell, so stay with us for that. Right, welcome back. You're still watching Health Talk, and we're focusing today on substance abuse. Now, helping a friend or a loved one struggling with drug or alcohol addiction is often a long and heartbreaking journey, and at times it can be so overwhelming that ignoring the situation may seem like an easier solution. As painful as it may be, it's important that you take the time to encourage your loved ones to get the help that they need. Right now, we're going to speak to two young people, a young woman and a young man, who are both currently receiving treatment at a clinic in Johannesburg. And they join us to share their experience. And these are not their real names, but I'm going to be calling them Stephen and Mary. So a very good morning to both of you. Thanks so much indeed for joining us. Welcome to the program.
Thank you.
Thank you.
Great. And thanks for sharing your story. I know that it's a difficult thing, but I'm sure that we can help so many people through hearing your story. Let me start with you, Mary, how this journey began, getting into drugs. Which one started it all and what happened next?
Okay, I started with Dacha, then I went to Nyaupe, then escalated to Rock.
All right. And what happens, though, when you start with this? What makes you go on to the other drugs?
Okay, usually when you start with the Dacha, you think, Dacha is nothing for me. Then you meet some friends. Friends can be some peer pressure. Can I speak in my language?
Yes.
Oh, okay. Then kalatela Nyaupe. But Nyaupe, I didn't know that I was smoking Nyaupe. I thought I was smoking Dacha.
Right.
They put Nyaupe in my Dacha without me knowing it, that I was smoking Nyaupe. Then, usually, I thought, hey man, this Dacha is too weak for me. I want to smoke that Dacha of this other guy. That one, inaling Nyaupe kamachar. Okay, then I am constantly smoking that Dacha, not knowing that I was getting addicted.
Okay.
In the point that in the end he told me, this is not Dacha. I put Nyaupe inside without me knowing I was smoking Nyaupe.
All right.
To the point that I took my own money and I looked for the dealers. I went to buy my own nyaupe. I learned how to do the stuff, kubofa and stuff. Then, okay, from nyaupe, I went to rock. I smoked rock.
Okay, we'll talk a little bit more about getting those drugs. Stephen, what was your journey? Where did it start?
My journey was quite tricky and it had a lot of ups and downs. So I started doing drugs as a sort of experiment, you see. Then it escalated to a point where I used drugs for social use. Then I started situating myself with friends who were going to make me feel happy with using drugs. That's when I got introduced to more drugs. Then I started doing drugs like nyaupe for downers. Then I took cocaine. Whenever we had no money, we would buy cat and crystal meth. Then at a later stage, I got totally addicted to a point where I couldn't function. I felt like I was abnormal when I had no drugs with me. So I did almost anything to get the drugs and to get my next fix. I even went to a point where I would steal anything at home just to get the next fix. And I was a bit destructive and problematic to the community. So, yeah, it was.
Yeah. How hard is it to get these drugs? I mean, you know, they're illegal. There's police everywhere. Is it quite easy to find these drugs? Stephen?
Yeah, it's easy.
Oh, it's easy because, to be honest, I was one of the people who were selling to satisfy and to keep my habits feeded, you see. So it was easy for me to get drugs with the police around and everything because we sort of have our connections and ways of selling and dealing, meeting with those people who supply us and hence smuggling to others. So I can always have the fix with me. So I wasn't selling just to get money. I was selling to feed my habit. So yeah, it's quite easy because we get skills. You see, we sort of come with miraculous ways of getting ourselves the next fix.
Yeah.
So yeah, it was easy.
Yeah, you manipulate the people you love, you lie, you cheat. And like me, when I escalated to rock, like I was raped twice in my life. Firstly, I was raped when I was 16 years old. Then I was thinking that I'm releasing the stress by smoking. Then I was raped again in 2018. I'm still going on the case. It's ongoing. Okay. Then I thought that when I was smoking, I was relieving the stress, not knowing that I was putting much more pressure on me.
Yeah.
Yeah.
So, Mary, when did you realize that you are addicted and that you needed help?
Okay, I realized this year because I have 3 sons now. My first son is at school. So I put my pride down and went straight to the teacher and told her, now it's enough. I need help. Can you please find me any help? I want to quit for the sake of my sons. Because I used to smoke in front of my sons and they are boys. What kind of an example that I'm setting to them? You see, even when I go out of this place, I want to take them to FAMSA so that they could get counseling for them too.
Stephen, talk to us a little bit about recovery, rehabilitation. I know it's difficult to make the decision, but once you do, does the help work?
It works, and that depends on the person. Because for my side, coming here took me a lot of courage, and it took me some time to come here because I think I started wanting to stop about 4 years ago, but I told myself I will go to rehab once I'm fully ready. So this is my second time coming to rehab, and I think the first one, it's because I missed out on the tools which I needed to face the world out there with a different perspective. So since I'm here, I'm learning a lot about the little things which I never took into consideration. So now I have strength and emotional intelligence, and my mental attitude has changed. So those were the two most things which led me to relapse and lapses every time I took a step away from drugs. So since I'm here, I can feel myself and I can feel in control of myself now, because I know the little things that I couldn't manage when I was trying to stop on my own. But now, since I had the help of the sisters here and all the social workers and other peers, they can help me understand myself more and get to ask, understand. I get to perceive, manage, and understand all the emotions within me. Then I don't just take any decisions now. I think hard about them before I make any decisions, because there's always that bad side, the bad voice in you.
It's a powerful story both of you have told us, and I want to thank you both for sharing this time with us and telling your stories. Thank you so much, Stephen and Mary. Thanks for your time.
Thank you.
Thank you.
All right, those are two young recovering addicts. And I think the top story here really is that it's difficult and I think sometimes almost impossible to stop on your own. So go and get help. It's a tough one. You need to be brave, but there is help out there. So if you feel like you've got a problem, you probably do have. So please seek help. Go and get assistance. All right, after the break, we'll be taking a look at a story produced by Health E News about Lebogang Tieho, who's an addiction to nyaope, and thereafter we speak to Caesar Mangagwe about who's the Director of Families and Social Crime Prevention from the Department of Social Development. Welcome back. You're still watching Health Talk. Lebogang Tieho Nico became addicted to nyaope when he was just 17 years old. His addiction eventually led him to being kicked out of his family home and asked to never return to his school. Lebogang found himself living off a dump site in Mamelodi in Soweto, in Pretoria. Lebogang is now 20 and is no longer a nyaope addict. He shares his story of addiction and recovery.
Each and every single time you wake up, you want the drug. Before you sleep, you want the drug. So I was kind of like addicted to the drug.
Lebogang Tieho Nico was once a drug addict living on the streets of Mamelodi. He became addicted to nyaope as a teenager. Nyaope is a highly addictive blend of cheap heroin and marijuana. It is usually bulked up with other substances like rat poison, ARVs, and even crushed ceramic tiles.
I turned into a monster because the things that I was doing, it was not the things that a normal person would do. I used to steal for people, I used to rob people, I used to beat people up, do kind of like bad things that a normal person doesn't do. I used to swear a lot at people in my neighborhood. In my neighborhood, they didn't want me.
Most of them, what they do is that they do criminal activities so that they can get a fix. And when you're talking about criminal activities, we're talking about things like housebreaking, hijacking, robbing people and stealing household items. They take them in for trade and then they get cash so they can get the drug.
A single hit of nyaope can cost as little as 30 rand. The drug is smoked and can give users a high in just a matter of minutes. Addicts become both physically and psychologically dependent on nyaope, which is also called wunga.
It really changed my personal life to me focusing on the drug and no more on my life. It really changed my personality. It took away the love I had for people, the love I had for my parents, and the love people had for me. Because I suppose that if you don't love, you won't be loved.
They're just focusing on one thing, and that's getting a hit. That's why you find most of them dropping out of school, because psychologically they don't get to grasp the information that they are taught at school.
December time, I was given a report card, and the comments where they were supposed to write maybe improve on your maths or improve on your English, the judge will never return to the school anymore. The drug can affect you to such a point that you don't care about yourself anymore.
Lebohang's parents were unsure of how to intervene and how to pull Lebohang away from Nyaope. They eventually kicked him out of the house. He found himself living here at this dumping site in Mamelodi.
I used to live there. I used to have a small shack there, whether it's rainy, whether it's cold, whether it's all kinds of weathers, all seasons. I used to live there, hustle there, sell copper, sell steel to the other recycling members that side and feed my drug addiction. Emotionally, I feel very sad. I feel very down for me to be here and think that I used to sleep here, I used to eat here, I didn't wash, I didn't take a bath, I did nothing. This is a kind of place that a person doesn't want to see himself in.
Lebohang's family eventually enrolled him at Teen Challenge Pretoria, a farm-based rehabilitation center. Here, he learned how to overcome his Nyaope addiction.
I really wanted to leave the drug, and there was another thing in my heart telling me that you're gonna die. Keep on smoking this drug. It's gonna lead you to where you don't want yourself to be in.
The kind of experience that they've had, it's quite horrible, because once they become clean, it is then they get to realize what Nyaope has done in their life. They become very much aware of what they've lost. They become very much aware of the time that they've wasted hustling for a hit instead of being at school.
Lebohang is now 20 years old. He has not smoked Nyaope for over a year. He is working hard at getting his life back on track. He has returned to school and is slowly restoring his relationship with his family.
How are you?
I've asked forgiveness from my family. Their response was good. They really now accept me into the family. They're very happy. My family thought that I'd given my life to the drug. I didn't care about myself anymore, so they didn't care about me because I was outside in the world. All they wanted me to do is just change my life. My nieces are really good. I love them so much, and also my sisters. I really want to inspire them. I don't want them to look at me and say, our uncle is a drug addict. Instead of following in my steps, they must follow in my good steps, not in the bad steps.
Yeah, our thanks there to Health E News. Great story there, and hopefully inspiring for some of you who might be worried a little bit about your current situation. Now, if you think that someone you love is addicted to drugs, it's important to handle the situation carefully. Before you talk to your loved one about help or treatment options for their drug addiction, you need to approach them about the problem. Now, a variety of drug addiction treatment centres and therapeutic approaches do exist to best match the specific needs of each individual. Whether you're looking for inpatient or outpatient treatment, there are a number of options out there for anyone looking to take their life back from substance abuse. Now, to help us understand this a little bit more and how to access these social facilities, we're now joined by the Chief Director for Families and Social Crime Prevention, Ms. Siza Mahangwe from the Department of Social Development. Thanks so much indeed for joining us, and welcome to the program.
Thank you, and good morning to your viewers.
All right, let's talk a little bit about these facilities. I'm sure that there's never enough, but the ones that do exist, are they easily accessible and are they free?
Okay, yes, maybe allow me to first start congratulating Lebohang for being clean for a year. It's not an easy journey. But we really draw inspiration from people like him. Okay, moving on with the question. Yes, there are facilities. Maybe let me start by saying the government or the state has 13 public treatment centers in all the 9 provinces. And then over and above that, we've got 120 treatment facilities that are run by NGO as well as private centers. And the NGOs want government to subsidize them to make sure that we increase access to these treatment centers. Of course, there are processes and admission criteria that we have to, the treatment centers have to use in order to admit patients there. The the admission is actually done in terms of the Act. So it does prescribe that certain people can be admitted as volunteers. Some can be admitted as involuntary patients or involuntary service users because of the conditions are not the same. So therefore, it does allow for both voluntary patients as well as involuntary patients in all the 9 provinces. And you don't have to pay, the state pay for everything.
Okay. So what sort of treatment happens in these facilities?
It differs. There's different treatment. Okay, we've got inpatient as well as outpatient. Let me start with inpatient. With outpatient. Outpatient, it's when a person is still in the community. You go there and attend, psychosocial or counseling services. You do some life skills as well as skills development programs that will help you and sustain you once you have managed to be clean. And then you also have inpatient. The inpatient is when they admit you, like literally hospital. You are admitted there, you move away from your family or your community. You are committed for a number of weeks. It depends. For instance, most of the public treatment centers they are running a 12-week program, while the private treatment centers, they've got different durations depending on the model that they are using. With us, I can only speak for government for now. For the state ones, we are running a therapeutic program called Universal Treatment Curriculum. It's in partnership with Colombo in South America. It's a tested program where you really, as a therapist, you must be capacitated first and you must pass the exam. And then you are able or you are allowed to actually work with the clients and take them through their life cycle as they are there. And you also support the family, because I heard some of the participants spoke about family support. It's quite critical. You are not alone in this. The family is very important that they are part and parcel of the treatment. They are also receiving support. They are also receiving treatment because they've been afflicted by your addiction. So it's important to gain trust. It's important to equip them and empower them so that they are able to support you in your journey as a patient or as a former user.
All right, okay. We're probably going to get a number of people calling in just to ask a few questions, and I think we've got one now. Tandy, who is in Alex. Tandy, good morning to you. You have a question?
Yes, I've got my cousin. He's very, very affected with substance. He's smoking, but he's doing lots of wrong things at home. Jumping fences, running away, doing wrong things to the neighbors. So, yeah, what I need from you is help.
Okay.
Yes.
Caesar, I guess this story you hear all the time, desperate family members. How do you manage if you're a family member with someone perhaps who's in denial, who doesn't want to get help? What do you do?
Okay, thank you. Sis Tandy, okay, in terms of the Act, there's a section 33 that says a person that does not want to go to a treatment center or he's in denial, he must be admitted as an involuntary patient. What does it mean? It means you must, maybe engage with the social worker, Office of the Social Workers in all districts, or a probation officer. What they will do, they will conduct an assessment, and they will also, based on the assessment, they will then produce a psychosocial report. They will also seek the medical report that will say, indeed, this person is using substances and what type of substances is he using. Then from there, the social workers on your behalf, they will approach the court and present this case before the court. The court will consider all the documentation and then issue a court order. The court order will then be designating this person to a particular treatment center, depending on the availability of beds, whether maybe it will be in the same area or in another area, but it will be within Gauteng. If it's in Gauteng, since you said Alexander, it will be in Gauteng. Then the person will then be committed to a treatment center, the public treatment center, and he will stay there for that duration. Maybe it's 12 weeks, it will be for 12 weeks. And that person, because he's committed by court, he's not allowed to leave. If he leaves the treatment center, then he is regarded as a person that have absconded. So therefore, the court will issue another order that person must be committed back to the treatment center until he completes the treatment. The problem is that people are not aware that there is this option. They are thinking that a person has to agree, and if a person says no, and say no, it doesn't, the state can still intervene and assist you with the court process.
All right. We've got another caller, Hazel from Bloemhof. Hello, Hazel. You have a question?
Yes, I have this question. Since my granddaughter was 12 years old, we saw that she was on substance abuse. And then I went to the social workers. The school called me in, and we saw that this child now, she's on these things. But up till today, this girl, she turned 16 this year. I didn't get help.
All right.
I've been running to the social workers. They said to me, the rehab, I said, please help me with my child. Trying to resend her to a rehab center, because now I can see she's getting out of order. She doesn't sleep at home. She doesn't come back home. When she leaves, she's not even going to school.
All right.
No, every day there were a lot of stories from the social workers department site.
Okay, Hazel, listen on the TV. We don't have much time, Caesar, so maybe if you can just perhaps guide her, what's the best line? And is there an issue with social workers sometimes?
We used to have a problem in provinces where they do not have the public treatment centers. But now that we have established the public treatment centers in all 9 provinces, that shouldn't be a challenge. But by saying that, I'm not saying there are no challenges. If there are challenges like now, you can, give them my numbers, then I can intervene and assist and make sure that the teenager have access to the treatment program. Because all the provinces now, they do have the treatment centers. There's no reason why she's not admitted there.
Caesar, thank you so much indeed for joining us and giving us this powerful information for help. Thanks for your time.
Thank you very much. Before I go, can I say on the 26th, it's an International Day Against Drug Abuse and Illicit Trafficking. We will be communicating with the whole world, including our country, to say enough is enough to drugs and there is a solution. If you need help, we are there to provide all the services related to drug abuse and alcohol abuse. I thank you.
Great, thanks very much indeed. I think that's a powerful message to leave that on. Caesar Mahangwe, who's the Chief Director for Families and Social Crime Prevention from the Department of Social Development. After the break, we'll be speaking to the chairperson of the Central Drug Authority Board at the Central Drug Authority of National Social Development about the National Drug Master Plan that was launched in 2020. Stay with us for that. Now, the National Drug Master Plan that was launched in 2020 by the Minister of Social Development, Lindiwe Zulu, is a blueprint for combating the scourge of alcohol and substance abuse, which has reached epidemic proportions in South Africa. The main goal of the National Drug Master Plan is to prevent drug use before it starts and early intervention to ensure substance users receive treatment and rehabilitation services and reducing the demand for illicit drugs. And here to tell us a little bit more about the progress and more about the National Drug Master Plan, we're now joined by Nandi Mayatulakoza, who's the chairperson of the Central Drug Authority Board at the Central Drug Authority of National Social Department. Thanks very much indeed for joining us and welcome to the program.
Thank you. Good morning, Peter. Good morning to your viewers and good morning to everybody who is involved on this program. Thank you.
All right, so tell us a little bit more about what a National Drug Master Plan does. When you set it up, what was the hope? And then we'll talk a little bit about what you've been able to achieve so far.
Yes, thank you very much, Peter. And I think I also want to congratulate you for having us, all of us, even the drug users. We now call them drug users, not drug addicts, because calling someone a drug addict is a negative word. So we want to thank you because, I mean, you know, substance abuse, alcohol abuse is a health problem. It's a mental issue, and it's not a moral failure. We have been told several times by the users that they don't like it. They no longer want to take it, and they want to be assisted. And therefore, we thank you for really considering substance abuse and alcohol abuse and other substances as a health matter. So maybe let me also start by saying that we are a new CDA, Central Drug Authority. We have been appointed by the minister. We are a statutory body. We are established by law, the prevention of and treatment for substance and alcohol abuse. We are a multi-sectoral advisory structure because we are made up of departments that have a responsibility on this matter. We are made up of the private sector that also have an interest and a responsibility on this matter. And we report to Parliament, we report to the Cabinet, but we do it via the Minister of Social Development. So indeed, our role is to oversee the implementation of the National Drug Master Plan of 2019 to 2024, which has already been approved by Cabinet in our country. So ours is really to ensure that it's implemented. We oversee it, we monitor, we evaluate the implementation, and we are able to report to the minister, we are able to report to the Cabinet and Parliament. So our role really is to coordinate, you know, the strategic projects that are being implemented by all the stakeholders, but we also need to recommend review at the end of 5 years. So with the National Drug Master Plan, what is important is that we have effective strategies on prevention, on early intervention, on reintegration, on aftercare services, as well as on prevention of HIV infection. And our concern is that, you know, users who are using drugs or substances, they do, you know, get infected by HIV. Some of them get infected by hepatitis B, hepatitis C. So our role really as Central Drug Authorities to ensure that those role players and stakeholders who are responsible for treatment do reduce harm amongst the users of substance. So indeed, a lot of work has been done by the CDA in the past, and we ourselves have started to do work. Our aim really, you know, as outlined in the National Drug Master Plan, is to contribute towards a South Africa that's free of substance abuse. And essentially, it's a South Africa that is going to be free from harm associated with drug use, misuse, and abuse. And as you have indicated, our goals are demand reduction, you know, harm reduction, supply reduction, but also informing people about the scientific studies that are out there and not misinform the people. So far the progress has been that we've been inducted already as CDA. We've been orientated because we're only 3 weeks old, but we've been able also to participate at various structures. We have been dialoguing with people who use drugs. We have been dialoguing with sex worker sector, some of whom do use drugs as well. And we have participated in the international network on hepatitis in substance users. But yes, Peter, what is important is that we realize that substance abuse and alcohol abuse is really a health problem. And we are beginning to change. We've changed our mindset so that we don't punish the users, but we support them. And many of them are beginning to say, look, we don't want this, we want to be supported. And I'm happy that you've spoken earlier about access to treatment centers so that we can reduce harm amongst them.
Okay, Nandi, I'm curious, when we start to rethink these, you know, often when people go to rehabilitation centers, they don't ask, the therapists don't ask you, where did you get the drugs? They actually go back to the conditions that set up the person to become vulnerable towards substance abuse. So I just wonder if part of the work that you do is to look at the social conditions that nourish substance abuse, family issues, societal issues, because it's that really is the bedrock of some of the problems that we see later.
Absolutely, you are spot on, Peter. It's important, and in fact, those who are at the treatment centers are getting training so that they can do exactly what you are talking about and be interested on where the users have actually received the drugs. And we've heard some of the users, the wonderful stories that they were talking about, that they themselves found themselves having to sell drugs. The drug lords out there are the ones who are encouraging the users to sell drugs. So these are the things that those who are at the treatment centers are being trained about. So we are concerned also as the CDA that we need to address the socio-economic conditions. Once we know that some of the users are saying it was a choice, it was peer pressure, I was experimenting, but we're also aware that it's because of where the users come from. The South Africa, experiences poverty, it experiences unemployment, young people are experiencing inequality. So we need to look at those situations and be able to address, the root causes of drug use. So safety in the communities as well, and what conditions exist in the communities. We are beginning to look at that, and we are working with the users because they are saying nothing for us without us. They know better, and they can advise us better on how to address substance abuse and alcohol abuse in the communities.
All right, and I guess, we've got the battle with illegal drugs, and that's pretty straightforward because they're illegal, they shouldn't be there. But there's also legal drugs that people abuse, and that's another whole layer of the battle, isn't it?
Absolutely, Peter. We do have illegal drugs, such as heroin, such as cocaine, meth, cat, tick, But we also have legal drugs. You will remember also very recently our Constitutional Court has actually made cannabis legal, but for private use, for medical use, for scientific use. So it's important for us as CDA, as we work with the local drug action committees on the ground, as we work with the provincial forums on the ground, as we work with communities, we need to, educate our communities on which drugs are illegal, which drugs are legal. So it's our responsibility also as CDA to ensure that there is access of legal drugs in our community, but also be able to ensure that people use this correctly. I mean, Peter, people take sleeping tablets.
Yeah.
Those are legal drugs. People drink alcohol. It's legal in South Africa. People smoke, it's legal, even though
Sadly,
it's done
we've run out of time, Nandi. We have to leave it there, but thank you so much for sharing your thoughts with us and the work that you're doing, and we wish you the best of luck with the plan. Thank you so much,
Peter, for having us. Bye-bye.
Thank you. Bye-bye. All right, and that's where we come to the end of today's edition of Health Talk. Join us again next week at the same time for more of the same. In the meantime, please take care of each other. Do all the protocols. We're right in the middle of it, so stay at home, wash your hands, sanitize surfaces, sanitize your hands, social distancing, and also please wear a mask. Very, very important. Cover your nose and your mouth. It isn't a chin guard. Take care, everybody. Bye-bye.